Be aware of signs and symptoms of adverse events that can occur during the pregnancy as well as during the postpartum period as well. That awareness that you might have as individuals and that if your family has can also lead to protecting you from poor outcomes. Childbirth education classes are really important to help understand the norms and the abnormalities that could occur during pregnancy as well. Another aspect is finding the right provider. And if that provider is not giving you what you need, you have the option to find someone else. Sometimes it may be tricky to do that, or it might be difficult, but there are ways that you can find a provider that you trust and that listens to you and that you can help, that you can partner with as you go on your healthcare journey. Also, from a support standpoint, it's important to have a support person as well. So that support person can be a family member, or that support person can be a doula. Doulas are so essential in the space of maternity care. A doula, by meaning, the meaning of doula is mothering the mother. So the doula is really critical in the care of the woman and the emotional support and the physical support prior to birth, during birth, and in the postpartum arena as well, to help support that mother and be that advocate if that person needs it as well.
Sometimes I feel like in the healthcare systems, people don't always know who the person is that they should go to when they aren't heard. So just knowing that you do have the option and the right to ask for someone on a higher level. So whether you're talking to the nurse and that nurse isn't listening, you can request to have a different nurse. If you have a resident that's coming into your room as, the physician, talking to them and asking, is your attending available, to be able to speak to them and just feeling more comfortable expressing those concerns. I think that also, writing things down that are important to you and bringing those with you when you come to the hospital, discussing those things prior to delivery with your provider.
Another way is to develop a birth plan for childbirth and develop a plan for the postpartum care as well. So do you have resources available for you when you go home and deliver? So is there someone that can help you with childcare, to help you with other items that you need to do so that you can rest and take care of the baby as well?
We as a community really need to understand what women are facing when they're pregnant and when they're having a baby, and we need to support women differently. So if I'm a person, I see a pregnant person, she's at the mall or she's at church or whatever, many times people will go up to you and say, oh, look how big you are, are you having a girl or a boy, this and that and the other thing, right? So what we really as a community need to start saying to people is, hey, I see you're pregnant. Who's helping you? Who's supporting you? Let me share some resources with you. And that needs to be a common conversation, whether we're at church or the grocery store or in our organizations like sororities.
Don't give up because the process may take a little long or the situation may be hard. We as individuals are to advocate for ourselves and take ownership of our bodies and what is occurring related to childbirth and the postpartum period.